everyone again. I promise this is the last time you see me. So this is a very exciting study that we have done. The program says another title, but we actually have the final results for the study. This was a point of care testing in PKU, a new era of blood phenylalanine monitoring. For the introduction, we know that dry blood spots are the standard for monitoring blood free in PKU. We know there are some issues with this technique, like delays in reporting the results that can actually affect a timely adjustment of the dietary treatment. And in the literature, we have questionnaires reporting that patients and caregivers have expressed the preference for a point of care testing device that they would be able to use at home for blood phenylalanine monitoring. So in here we have a new system, the egoo.health system. This is a novel point of care testing device that was developed for home use by patients with PKU and also for parents or caregivers. This is an enzymatic assay coupled with bioluminescent detection system. It converts light signals from a capillary blood sample into measuring a quantitative phenylalanine. So on the right side, we have the egoo.health system. It is composed by three elements. So we have the egoo analyzer. So it looks like a little mini espresso machine. And then we have the egoo collect. So we have an egoo collect where the blood is collected from the finger prick with a pipette. Then this is put into a capsule that goes into the egoo analyzer. And then we have the Egoo Connect app that is connected to the egoo analyzer, and we will get a result within 29 minutes. So the aim of our study was to compare blood phenylalanine levels and caregiver usability of a point of care testing device compared with our dry blood spot monitoring for PKU. For the study design, we had actually two groups in our study. We had a first group that we did our study at home conditions. We had 18 PKU patients, and we also included two healthcare professions where we did this study in the hospital. And the reason why was because we wanted to also test for normal blood phenylalanine levels with a point of care testing device. In both groups and in all of the visits, we did both the dry blood spot measurements, and at the same time we performed the egoo.health system. During the study, we had 5 different visits with a visit window of 7 days. So on the first visit, we did a structured training of how to use the point of care testing, and then we would retrain if needed on the following visits. In terms of blood that would need to be collected, so we have an estimate of 100 microliters of blood collected on the dry blood spots versus 65 with the point of care testing. And in all the visits, we've done a usability questionnaire that was performed for the caregivers. And in the end, we also did a questionnaire where we compared the dry blood spots with the point of care testing device. For the results, we had the group with PKU with 11 males and 7 females. The mean age was 8 years, ranging from 4 to 14. And in the 2 healthy adult volunteers, the mean age was 37, 20, weight to 45. Overall, in this study, we had 100 blood samples collected. So we had 100 dry blood spots and 100 samples from the egoo system. The blood phenylalanine levels were similar in the average, 274 micromoles per liter with the point of care testing versus 270 with the dry blood spots. And overall, the results, in terms of percentage, the difference was 4.6% higher with the egoo system compared with the dry blood spots. So on this left figure, we have the linear regression regression curve comparing both systems, so the point of care testing and the dry blood spots. We could see a close correlation between the two systems, and we could also see that the differences were similar both at low levels but also at higher levels of blood phenylalanine. On the right side, we also have a blind output plot analyzing the percentage difference versus the average. We can see that the majority are closer to the zero. The range is between less 50 to plus 50, and we have some outliers that we can identify that were related to some issues with the technique that I will show you in the next slide. So for the usability questionnaire, we could find some issues with the technique. So 17 times we had to repeat a sampling due to air bubbles in the pipette. So the pipette is used to collect the blood from the finger, and we found in the study that if you don't have the right position, air goes in, and then you wouldn't have enough blood to be analyzed, and this could affect the results. We have 5 occasions where blood was adhering to the inner wall of the egoo collect, so it wasn't going through the filter paper, and this would impact on the results. 2 times the pipette was squeezed more than once, limiting the full blood release, so we need to do just 1 squeeze. Another 2 times we had the plasma not successfully separated, or at least it wasn't visible, so we were doing this study in home conditions. Some of the homes are very dark, so it was hard to see. But thankfully, so this egoo collect system has changed already, and now we have a changing color that can be easily seen when the plasma comes through. We had 2 times where there was very low blood phenylalanine levels, and this had to be repeated because we identified a faulty in the capsule. And 1 time the lid of the egoo collect, when it was closed too fast. So basically there wasn't enough time for the blood to dry on the filter paper, so we would have an effective result. So overall, we could see that usability improved in visit 1 and 2, so most of these issues were solved by visit 3. At the end of the study, we did a questionnaire with the caregivers comparing the dry blood spots and the point of care testing. And although we can say that it needs to be carefully handling this new system, all the caregivers prefer to use the egoo system compared with the dry blood spots. This is some of the thoughts that they shared with us in this questionnaire. They said that it was better to find out the results quicker. The sample could not get lost in the post, which is a current issue. Faster results are very important for adjusting the dietary treatment. The technique was less time consuming, less messy, and fewer bruises on the finger. And also there was less blood needed to do the technique, and faster to do a sample actually when you get used to this new technique. So for the conclusions, the point of care testing device demonstrated a strong correlation with the dry blood spots. The point of care testing was well received by the caregivers, and we could see that usability improved with time. If given the choice, they would prefer to have this device in comparison to the dry blood spots. And hopefully in the future timely patient-led monitoring of blood phenylalanine levels at home may improve PKU care. I would like to give a big thank you to our team, a big thank you to Anita, because we have spent a lot of Saturdays going around the Western Midlands collecting the data, and a big thank you for the patients and families that had to put up with us. So, thank you.